found out that you guys are sophomores, right?
Yeah.
Okay, so you have a few years to kind of figure out what you like to do or what's right for you, whatnot. This presentation here is just a very brief kind of overview on a career in medicine. Now, certainly, medicine encompasses a lot of different things, right? So a lot of people I hear want to be doctors or nurses in this class, which is great. Those are fabulous, awesome aspirations. But of course, in medicine, there are pharmacists, there are, excuse me, physical therapists, there are physician's assistants, nurse practitioners, all these different potential careers that you could consider. And so, but this particular talk focuses mainly on medicine as in physicians and doctors because that's who we are. That's what we went to school for. And so we're going to go through this fairly quickly, but of course this is a relatively informal presentation. And so if you see anything and you have any questions, please let us know. Please stop us, raise your hand. We're happy to entertain any questions anytime, even before the presentation. If you have any questions for us, we're happy to entertain them as well.
So who wants to become a doctor? Raise your hands.
Wow.
Let's see,
That's
a few
great.
hands. Who wants to become like CEO of a hospital? Okay, that comes later. Maybe you want to be a doctor first. How about a nurse? Wow, that's a great profession. Yeah, and then there's so many other things, but nurse and doctors are the main goals to start with, and you branch out from there.
All right.
Good, so we know who we're talking to.
All right, so anyway, can everyone see the slides? Maybe I'll move the water bottles over here so everyone can see. You guys can see okay? The light's okay? We don't need to have the lights dimmed or anything? You guys good?
Yeah.
Okay, very good. So, as Ms. Olson mentioned earlier, I'm Tammy Wu, Dr. Lee. He's a general surgeon, I'm a plastic surgeon. So I don't know if you guys even know what that means. Other than I know that you probably have seen TV shows that show what plastic surgeons do. Although usually what's on the TV shows are a little bit one extreme versus another. But I'm going to show you what plastic surgeons do. There's a lot that we do. General surgeons typically are the ones that save people's lives. And so if you were in a car accident, for example, if you fell from, I don't know, while you were hiking in Yosemite, fell off the Half Dome, something like that, Dr. Lee would be the one in the ER resuscitating you. I am the one who comes in afterwards if you got a burn, if you got facial fractures, and your face got messed up by dot bites, whatnot. I'm the one coming in to get that fixed for you. So that's generally plastic surgery versus general surgery, whatnot. But let's go, yes.
We cover the surgical specialty. Medicine is broadly divided into medical specialties and surgical specialties. And maybe you could have lectures from somebody in a medical specialty.
Mhm.
So it's very confusing for even sometimes our staff. Almost every field in medicine is kind of split up into medicine and surgery. So let's say we're talking about like a dermatologist. A dermatologist surgical counterpart, dermatology is more of a medical specialty, but the surgical counterpart would be plastic surgery as a broad comparison. Like for me, I'm a general surgeon. The other counterpart in medicine would be perhaps like a GI doctor. You've heard of urologists. Can you guys think of what might be a medical side of a urologist? Urologist is a surgeon for the kidneys. So basically I'm asking, what's the name for a kidney doctor who specializes in medicine
Of the kidneys.
of the kidneys?
That's a difficult
That might be a profession you guys will become. It's nephrology. But how about an easier one? How about, let's say I'm a cardiac surgeon and I wanted to ask you guys, well, who's the medical side for a cardiac surgeon? You know, you've heard of cardiothoracic surgeons. You might see them on TV. There's these tough guys, but there's these guys behind the scenes that are wizards with medicines and diagnostics. What are those guys called? They're not cardiac surgeons, but they're the fill in the blank.
Study of the heart.
There's
Cardiovascular surgeon?
cardiovascular surgeon's the surgical side.
Right.
And what's the medical side?
Yes.
Cardiologists.
Yes.
I mean, this is a good one, and I'm also a trauma surgeon, so I wanted to ask you guys, what would be my medical side? Let's say, who would be the medical type of doctor? That's not a
That's
trauma
equivalent to-
surgeon, but they're the
right.
medical kind. The ones that like drugs, they know antibiotics, they know what to do for a heart attack. I'm the kind of guy that's an emergency type guy, oh, I gave it away, that takes care of stab wounds. You know, Valentine's Day, you don't like the flowers and you stab the other guy, I take care of those things. But then there's the other side of that type of emergency. Do you know the name of that kind of doctor? Emergency room doctor.
Right,
ER
exactly.
doctor. So they're the medical side, but I thought we would start with that. We represent the surgical side, but maybe another way of thinking of it, and it's a little crude way of thinking of it, is they're people who do very well like at prescribing medicines and looking at lab tests. Those are the medical doctors, very important. But we're the surgical doctors, we're very good at using our hands and doing procedures. And so the ER doctor would be very good at deciding what you need to do as like you have a cold or you have a heart attack, very important. But then I'm the guy that has to take the bullet out, if that helps. Same with cardiac surgery. The guy who does the heart surgery is the cardiac surgeon, not the cardiologist. It's a little confusing, but I thought we'd start there.
So regardless though of whether you want to become a surgeon or whether you want to be a medicine type of doctor, there's sort of a particular pathway that you would take to get there. So how does someone become a doctor? Or how does someone become a surgeon, or what does a plastic surgeon do? If we have time, we can talk about women in medicine, surgery, but that's if we have time. So earlier, actually, my very first slide is a disclaimer. So in this particular talk, I do show pictures of some of the work that I have done, some of the work that I have encountered. It may not be all my patients, but there is some sort of graphic material in this, and so if you don't want to look at it, please close your eyes or turn away. I don't want to offend anyone, but this is just sort of what happens in medicine, and just to share with you guys. So, you guys are in high school. You're all sophomores in high school right now. So, after you finish high school, then you will go to college. So, I know that there are a lot of people that go to a junior college and then transfer to a four-year college. And that's okay too, regardless of whether you go straight to a four-year college or whether you go to a junior college first and then transfer to a four-year college. Regardless, in order for you to get to medical school, you must have a four-year college degree. That's the only way to get there. So you're graduating from junior college, you cannot get to medical school from there. So somehow you have to have finished 4 years of college in order for you to get to that next step, which is medical school, which is typically 4 years. Assuming you don't do any research or take any time off, it's 4 years. Then after that, you have something called residency training. What exactly is residency training? So after medical school, you will actually get your degree for people to call you Dr. So-and-so. But you haven't really had much in terms of clinical experience, how to take care of patients, how to maybe do surgeries, different things like that. So residency training is basically that part of your schooling in which you get trained on how to take care of people, how to do surgeries, and so on. So the shortest training is 3 years. And so what does 3 years get you? Family practitioner. So all of you probably have pediatricians, family practitioners, your primary care physician. Those people get 3 years of training after medical school. Then they can start practicing. They can start seeing patients. They can take care of you. They can prescribe medicine. They can make diagnoses on what's wrong with you, if you have a cold, if you have the flu, whatnot, so on. For those of us who do surgery, the surgery training is typically at least 5 years after medical school. And that's the shortest training. Typically, most surgeons will have undergone at least, on average, 6 to 7 years of training after medical school. So I get this question a lot. well, how much schooling do you really need to get to where you are? And so I think that this breakdown probably makes it a little bit easier to see. So for me, as a
Let's
plastic.
take guesses.
Oh, okay.
Let's take guesses, okay. How old do you think I was when I finished my general surgery and trauma training so that I could actually practice on my own to be a doctor? How old do you think I got to be? Guess on the side.
33.
33, that's actually correct. Good guess. So I think you guys are maybe close to half that age of 33. So where you guys are now, it's like half the schooling to become a surgeon. It's a little faster to become an internal medicine doctor. It takes a little longer to become a surgeon. That's why surgeons have bigger egos. They think they went to school longer, so they deserve every. Maybe it's like they got all this pent up, like delayed gratification. So that, it took me about 33, and that's considered early. That means
That's
I went
very
through
early.
straight through, and I got there as fast as I could. We have a question from the back.
Yes,
As
Denise.
it- What, do you mind saying how old you were when you finished the process?
I was 33 or 34.
Oh, okay.
Yes,
Similar.
I
yes.
think we finished at the same time.
And you guys were that age once you guys finished the residency?
Right, and that was actually going straight through, so we never took any gap years. I know this is a term that some of you may be familiar with maybe family or friends who are on this path currently to try to become a doctor. It's very popular now to take gap years. In other words, between maybe even high school and college, you decide to take a year to do some work that, you know, part of it to try to save up for college, part of it maybe just to get some work experience, so on. And then you go to college, and then between college and medical school, maybe you decide to take some other, you know, another year or two off before you go to medical school, and so on. Usually between medical school and training, there's no gap year because you want to go right straight through. If you take any time off, it's always frowned upon between medical school and training. And so both of us went through actually everything. So both of us actually, from high school, we were accepted into medical school.
We were very fortunate, so.
Right, we were one of the 60 students in the entire world that were in this particular program at Brown. They
You guys
took
get a
60
chance to apply
students.
to that too, Brown
Right.
University.
Right. So the PLME program, the program in liberal medical education takes, or it used to take, I haven't looked at it recently, it took 60 students per year from all over the world into this particular program. And Dr. Lee and myself were one of the 60 students who were accepted into medical school. We were guaranteed a spot in medical school as a senior in high school. So before we graduated, got our high school diploma, we knew that we were going to be going to medical school 4 years after college. And so indeed, that's, you know, that's straight through. And then from medical school to residency, for me, in training for plastic surgery, I actually went through a straight program as well, because typically plastic surgery is something called fellowship. What a fellowship is basically additional training after your residency training. So your residency training, you come out, you're a doctor, you can practice whatever, but plastic surgery, typically you need additional training. You need to apply to another program so that they can train you to become plastic surgeons. And typically, it actually, the most common route is become a general surgeon and then become a plastic surgeon. For me, I was accepted in a program that was actually a straight through, so I was a plastic surgery resident from day one of my training. It was a 6-year training for me, and that was short for plastic surgery. But that's only because I got to practice plastic surgery from day one of my training. Typically, if you are a general surgeon, you do 5 to 7 years of general surgery training, you apply to plastic surgery, and that's another 2 to 3 years of training. So that's why it's a 6-year actually was a short, probably one of the shortest periods of time for residency training. But of course, to get into one of those programs is, again, very competitive. When I graduated from medical school and I applied, there were only 30 spots in the entire nation for something like that. And for a real program that was accredited like that, there were 18 spots. And so really, I was applying to 18 spots, competing with everyone from the United
It's part,
States.
there's only been 2 people in Modesto since we've been here that have gotten into the Brown program. Yeah, I don't know if they came from Grace Davis.
No, I think they were from Modesto High. Yeah, I think they were from Modesto.
So one of you guys could be the first.
Yes.
Yeah,
What's the
Yes.
program called?
It's Brown University.
It's called Program in Liberal Medical Education. So PLME is actually what it's called. It's an 8-year program, so you don't shorten your college years. You still do 4 years college and 4 years of medical
So
school.
basically you combine these 2 together.
Right, right.
Into
So-
8 years.
Right. And so,
Yeah.
so the benefit of that is that we didn't have to worry about taking the MCATs, which is basically that big national exam you have to take.
It's like the SAT for doctors.
Correct. It's SAT exactly, or LSAT for lawyers.
It's a lot longer, it's a 2-day exam.
Right. And then you have to, of course, apply to medical school. You have to make sure, because my roommate was pre-med. My roommate in college wasn't in the program, so but she wanted to become a doctor, and so she was pre-med. So every single day I would hear her tell me, okay, I have to drop this class because I'm not getting an A in this class. Okay, I have to go take that class because I can get an easy A in that class. And so there's a lot of, unfortunately, it's stressful as it is in college.
We don't know too much about that test because we never took it.
We never had to.
But it's a rite of
right.
passage for 99.9% of the doctors out there.
Right.
But we're part of that 0.1% that out of high school, they said, well, you guys are smart enough, you don't need to take the test.
So,
We just accept you into medical school and undergrad all at the same time.
yes.
So what did you guys do in high school that made you guys stick out so much? You got a full 8-year, right?
That's a good question. To tell you the truth, I don't know for myself. But when I look at other people, including actually Dr. Lee in the program, I am amazed that I actually got it. I feel like I probably just.
Yeah, I know, it's hard to know. I mean, you just do yourself, you do what you do.
Because,
I mean, I graduated #1 in my high school. But then everybody in my class was #1 in their high school.
everyone at Brown was number
The
one.
only
or
person
number
I
two.
knew that in my class that wasn't #1 was her. She was #2. So, but then speaking of that, she made up for it because even in our 30 that we were accepted to Brown, she graduated #1 of us. So she just made up for lost time. They're slow starters.
What did
Yeah.
your guys' GPA look like in high school?
What-
Yeah.
What did your
GPA.
GPA look like in high
Yeah,
school?
that was so long ago. I didn't have we didn't have GPA in my high school. I was in New York. It was based on a score of 100. 100 being like you got 100 on every single test. So I was like 99.6 or something. So
And for,
it was pretty.
yeah.
It was the highest score in the school.
So, for me, I also didn't have GPA, but I can tell you that when I was in 9th grade, I almost failed European history.
There is
Yes. But,
late bloomers.
but I have to say, after that, I did, kind of shape up and such because so a little bit about myself. English is not my native language. I wasn't born here. I didn't grow up in the United States. I actually was born in Taiwan. I went to school there and I came to the States when I was 11. Not knowing the alphabet, not knowing anything, the culture, nothing. And so, and I didn't think I was staying because my whole family came and then we were planning on going back, or my parents were planning on going back a year later. So we lived in New Jersey and I literally watched cartoons all day long for a year in New Jersey, thinking that I was going to go back to Taiwan to continue my schooling. But then my parents wanted me and my older brother to stay here to continue our education, so that's what happened. But it was quite a struggle for me, so I struggled actually before high school. and then in high school, the European history thing was only because I got on the cheerleading team and I just thought, life is...
Cheerleaders here? Yay, well, she was a
Yeah.
cheerleader.
Yeah, life is so much more
There
fun as a
may be-
cheerleader, so I'm not gonna
You might still
study.
make it.
So actually, that's what happened. But then after that, I remember why my parents wanted me to stay here. I kind of woke up and I said, you know, I can't just do this because my parents are wasting their money for me to sit here and play and not do anything. So I really worked hard to try to get my grades back up. So yes, indeed, I graduated number 2 in high school, which I was somewhat disappointed because I was wanting to graduate number 1. But I think it's hard when you fail, almost fail a class, when other people could, you know, have straight A's all throughout. But anyway, so long story short, to answer your question, actually getting back to your question, Talia, about like what did we do that made us stand out? I think that for Brown, I think that they're looking for unique individuals. Unique in the sense of what do you have to offer? What are you bringing to the table that other people cannot or can easily bring to the table? So I can tell you that the 60 students in our class, everyone was different. Everyone was so different that, you know, you go to college and you think, oh, you're going to find your friends who are like you. Within those 60 people, everyone was different. There was no one that was, you know, just the same as the other person. But what I did discover was all these 60 people were in some ways self-starters. So we all did a lot of things on our own without
Parental pressure, teacher pressure,
Correct.
peer pressure.
Right, we just wanted to do things because we wanted to, because we were interested in it, because we felt like this was a good thing to do, whether it's, whatever it may be. And
So emphasize those things when you go to college interviews. Emphasize that you did something on your own.
right,
Or whatever you did on your own, talk about that stuff.
right. But then of course, when you do that, they'll ask why.
And you have to have you have to know, you have to own it.
Right, and so you must have good solid reasons as to why you wanted to do what you wanted to do. Now, Dr. Lee actually just,
Yeah, I did research in high school.
he did, so he did
I did
research,
cancer research at Roswell Memorial
Institute.
in Buffalo, New York.
right,
But then, of course, when they ask you about your research, you actually have to understand it. You can't just say, my teacher told me to do this. Yeah, so you gotta understand your cancer research.
right. So the scientific method of the hypothesis, testing your hypothesis, doing the statistical analysis, doing the discussion, drawing the conclusion from your analyses of the data collection and all that stuff, that's part of the research. And in addition, Dr. Lee actually represented the United States and went to Russia during that time for music, for violin. And additionally, he was concertmaster at Harvard Summer School, in addition to being the concertmaster for the youth orchestra in the state of New York.
It was so long ago, but I was ranked like number 1 or number 2 as a violinist in New York. So I mean, I had all these great things. I think what colleges look for is, they just assume everybody has like a perfect grade, or near perfect grade, near perfect SATs, and then they look at the other stuff. And then it's the other stuff that makes you unique enough to get in. There was a kid in Modesto, I thought for sure he was gonna go to Brown University too, because he wanted to go there. And he talked to me, of course, to get advice, and he had a perfect ACT. He was in the newspaper for a perfect score for his ACT, and his SATs were near perfect. He graduated number 1 from his school and everything. I thought, this kid's just like me, but smarter. And he still didn't get into Brown. So I couldn't figure out, and he was like number 1 in the debate team as well,
Yeah.
in the United States even. So he competed nationally.
So it's hard to
He
say,
went to
but
Enoch.
it's possible that maybe there was someone else just like him that they preferred, the admissions office, people preferred over him for some
But
reason.
he's fine, he went to Cornell instead. And he aced Cornell, he went to Cornell, took the hardest classes there and got the best grades. I mean, he kept in touch with me, he'd tell me all that. And now he's at Yale Medical School, so
Right.
if you don't go to Brown, it's okay. It's not the end of the world.
There's still a lot out there.
But I like Brown so much, I turned Harvard down, I turned Stanford down. And I'm proud that those schools wanted me, but I wanted to go to Brown. And so do keep Brown in mind when you're applying, because it's such a nice feeling to have to skip a gigantic test. And that's not the main reason to go there, but it's just like you spend You waste so much energy just studying for a test. Instead of putting that energy into a test, you could spend more time becoming a better doctor. Because becoming a doctor is not just trying to pass this one test called the MCAT. So I thought it was better for me to become a better doctor if I could skip that step.
Yes.
So did you guys apply your senior year, or how did you guys apply, or how does it
Yeah,
Yes.
it
It
was before
was the
this.
fall, no, it was the
Yeah.
fall of senior high school, right? Yeah, you're talking about,
Mhm.
yes, yes, it was the fall.
That you applied. Yeah, then I got in early decisions, whatever they call it.
Yeah, I did regular decision, yes.
Did you guys go to a public school or a private school?
Public for me.
Yeah, I went to a private school, because I had to go to a boarding school because my parents weren't here. So I was actually here by myself. And so, with my brother so we were in Atlanta, Georgia, actually, and so my parents had to find a private school that had the boarding facilities for co-ed, for both boys and girls. And that's where they found it with a relative who was 2 hours away, essentially, because we don't have a lot of family in the States, so.
Going through this process of becoming a doctor and getting into these programs, it's a competition. It's a competition like the Olympics, and it's maybe even harder than that. And you got to take your academics, like your training, to get that gold medal. And the people who get the gold medal are the ones that get into become a doctor. And so you got to take the academic training very seriously and train like an Olympic athlete, but your Olympics is becoming a doctor. And I was going to point out that when she wrote that EMD is at the end of the 4 years, but your training, actually, a lot of your training to become a real doctor is after you get that MD degree.
Right.
So a lot of times, the really cool benefit of becoming a nurse, you get your nurse degree, then you get a job and you do a lot of on-the-job training. And so they
Right.
kind of have a residency in their own way, but they actually have a real job. For us, we get paid like minimum wage, just a little bit to
Actually,
do
less
residency.
than
Less than minimum
wage.
wage. Yeah, there are ways around that. There's things written in the rules that say that doctors don't need to be paid minimum wage. The doctors don't need to get overtime. And so they find ways to pay you like $2 an hour, and you're working 140 hours a week. They made rules now for residents that they can't work more than 88 hours a week now.
Right.
Yeah, because it's a little bit of an abusive system where they use us as cheap labor. But we learn a lot in the process, so it's valuable.
Right.
But now that the residency is only 88 hours a week, so the residency time has actually stretched out a little longer. So this 3 years that we thought would be the minimums, sometimes it's a little longer now. They're talking about stretching the time frame because the residents are graduating and not getting certified in their specialty as easily as before. Because they're lacking a little bit of knowledge because they're not working all night long like we do. So we graduated a long time ago before they had these rules in place. And they were trying to all work us over 100 hours easily every week.
Yeah. And it
The normal
wasn't,
week is 40 work week, 40 hour work week.
for most people.
Yeah, but doesn't apply when you want to become a doctor.
Right. So I actually remember when I was in residency, there were times when I would stay up, not go to sleep for 2.5 days in a row. And I would just keep working. And we had surgeries that lasted 18 hours. And so you're just there for 18 hours. But I think that probably doesn't really happen anymore these days because of all the rules and regulations that are
There's a
in place.
TV show out there, I only watched a few episodes though, that tries to talk about the story of becoming a surgeon, especially trauma surgeon. It's called Grey's Anatomy. I think it's probably still on TV. But it's kind of, they made it look a little more glamorous. But they have some of the ideas right. It's kind of, I watched a few episodes, I'm like, wow, that's kind of how it is. And they just made it look a little easier and a little more like romantic. Yeah, so that made it good for TV.
Yeah. So,
So those guys are surgeons.
so this is, so you guys will be going off to college at some point in time, whenever it is. College is a great time in your life. I would say, even though I know earlier we talked about how you need to be training to become a doctor even before you go to medical school, but at the same time, college is a time of your life that I feel you would never get to live it again after it's gone. So that's why I really encourage people, if you already know what you want to do, if you know you want to become a doctor, try to apply to these straight programs, because I can tell you my college was so much more, my college classes were so much more enjoyable, because I knew I was already in. I didn't have to worry about studying for the MCATs. I just had to maintain a B average so that I
You
can,
get fired from school.
right, so that I can just keep going to medical school.
Actually, apparently it's easy to get fired from school, so a B average is not as easy as it sounds.
But you can take classes, so for example, I took a lot of philosophy classes. I majored in French when I was in high school. So I actually took a French literature class and all of that. So something to really think about, because like I said, you never really get that time back when it's gone. So, medical school. So, we kind of talked about this a little bit earlier. So I know we have been talking about all this a little bit here and there. So how do you get there? So first of all, of course, first and foremost, academics. Why is academics so important? Because actually I've just been talking to a student who is currently a second year medical student right now. He's actually going to one of the medical schools here in California. And he called me for advice because he said that he has, and at his school anyway, he has an opportunity to take 3 remedial tests for 3 different classes. And he's on his 3rd one. And he just got notice recently that the committee, the academic committee at the school, is thinking about basically kicking him out. Even though, yes, they are told that they have 3 possibilities, 3 remedial tests that they can take and they're okay. But my point of telling you that story is that I think that for the most part, medical school is a place where you must know how to study. You have to know how to study before you get there. If you want to try to find out how to study, it's too late.
Studying is a skill.
And studying is a skill that you can practice, that can be applied.
I think I would have been better at that, even though I did so well on paper. I think there was a lot of inefficiencies in my way of studying. So if you could perfect it before you get to college.
Right, and studying, actually, believe it or not, is an endurance sport. It really is. And I don't care what anyone says about studying, it's an endurance sport. Because I can tell you that just like running a marathon, and I don't know if any of you have participated in Teens Run Modesto, where you participate in half marathons, full marathons, you know the training that you must put in to finish that marathon in a relatively uninjured manner, right? And finishing the marathon feeling good about yourself and all that. Same thing for medical school and getting that medical degree. It's an endurance sport. It's like a marathon. And so you must know how to run before you can run a marathon. So you must know how to study before you get to medical school. So I think that if there's anything to take away from this talk today, is that you must really reflect within. Ask yourself, do I have what it takes to really do the endurance sport of study? And if you do, then go for it. You should, absolutely. But if you study for a few minutes and you're distracted by something else, and you feel like, oh my gosh, this is so boring, okay, I'm gonna go do something else now, okay, and you come back an hour later, okay, that will not work. And I think that that was the problem with this particular student, is that he actually didn't really know how to study. And he didn't have the patience to sit down and really study. And so that is really important. And so this is actually already expected before you even get there. Extracurricular activities, and so we talked about that a little bit earlier and such. And so for me, I don't really know, because I English was my second language and really French was my 3rd language. And so I really didn't have that much time in high school to do anything extracurricular. I know that I was on the cheerleading team, but that was short-lived. But when I took French, I actually did excel in French as well. So I shared first place in Southeast Regional French competition, when I was a senior or junior in high school, actually. And so maybe maybe the languages is what I excel in, I don't know. But that was essentially the only thing that I felt like stood out in my application to Brown that maybe they thought was a little bit special, I'm not sure. But we talked about this a little earlier, something special, something different, that makes you stand out, that makes you unique. And so, of course, every one of you is unique. Everyone is unique. But how do you make sure that someone else knows? How do you make sure that the admissions officers know that you are unique, that you are capable? And so that's something that you have to work on as well in presenting yourself well. Research. So Dr. Lee did the research that he talked about, where he did basic science research, bench research. Bench research referring to literally you're in a lab and you're doing research and you're doing the basic science. There's the clinical research where you're actually maybe at the hospitals, talking to patients and or collecting blood samples or something like that. And so that's a little bit different.
Yeah, that was kind of like research I did in the summer, like not during school, but just when school was out.
Mm-hmm. So, yeah, so basically maximize your time, utilize your time well. Publication, presentation, performances, etc. So publications, publishing something in a peer-reviewed journal. So I know these days is you can actually publish yourself. You can have a YouTube channel that you dedicate to something that you are interested in. And so perhaps, since you guys are interested in medicine and such, maybe there is a particular topic that you're interested in, and you can start a YouTube channel that talks about this, and that every single week you do a little bit of reading, a little bit of research on this particular topic, and or something else, and you talk about it, and you actually teach it to other people who may be interested.
Do you guys have YouTube channels? Publishing them? Yeah.
Okay. But anyway, so I think that back then when we were growing up, publishing in peer-reviewed journals was something that was, so what a peer-reviewed journal is basically a journal that's reputable, that people recognize as, oh, okay, things in this journal are worth reading. That's what a peer-reviewed journal means. Presentation, presenting at national meetings, and so on. Performances, if any one of you play a musical instrument, you're in the theaters, you perform, whatnot. I mean, these are all definitely things that you can put a portfolio together and present it at your interview. So, okay, so in talking about all those things that we talked about earlier, one thing or several things that I do want to emphasize is that you don't go into medicine, whether you want to be a nurse, a doctor, a physical therapist, whatever, without all of this, okay? So the main reason you want to go into medicine, for the most part, I hear from people, is that you want to help people. You have had some personal experiences that made you feel like medicine is for me, whether it's being a doctor, whether it's being a nurse, and you want to help. And you want to help others so that they have a better experience than maybe you did before when you have the experience encounter with the doctor or the nurse or the hospital, whatnot. So, in my opinion, if you are honest, if you have integrity, you have compassion, you are empathetic, and you have a kind heart, those are, in my opinion, the most important qualities of a doctor or a nurse or someone in healthcare. Because if you don't possess any of that, then medicine is not for you, for sure. It's just, you shouldn't even consider it, because we're dealing with human lives. We're dealing with people's health. And just as you wouldn't want anyone to mistreat your health, you wouldn't want to mistreat other people's, right? Because a person is always someone's son, someone's daughter, someone's mother, someone's sister, someone's brother, right? So we want to treat other people like we want to be treated. And so that's why this is important. Now, patience can be practiced as well, but patience is a must when you're going through this process. So this is what we talked about a little bit earlier. Dr. Lee had talked about internal medicine versus surgery and such. And so these are the two general big categories for medicine. And so this is sort of what we talked about earlier, right? The medicine equivalent versus the surgery equivalent and so on. And so some of these terms probably seem very foreign to you. Some of them probably seem more familiar. Dermatology, plastic surgery certainly probably are familiar. Cardiothoracic surgery, cardiology, but then these other ones may be a little bit less so. But general surgeon is a general surgeon who does traumas or other general surgeons. The equivalent actually is in the medicine field is GI, gastroenterology. So we talked about residency. We talked about this process a little bit earlier. We talked about this earlier as well. So any questions, any other questions before we go specifically into plastic surgery so far? Okay, so this is just about plastic surgery. So this is part of sort of what I have seen, what I have lived since I become a plastic surgeon. So this is a slide, even though it's old, but I think that it shows basically this is a whole bunch of surgeons, plastic surgeons actually, all of them, working together. And do you know what these things are that they're looking through? Anyone? What's that?
Microscope?
Yes, they're microscopes. So you can see that these are microscopes. Some of them are actually assisting, some of them are actually operating. And I know it's probably hard to see, but for orientation purposes, this is the anesthesiologist. The rest are all surgeons. And they're working on the arm, the foot, the foot. So this was a traumatic accident. And this person has sustained multiple fractures, multiple open wounds. And so he had been resuscitated by the trauma surgeon, and now he's in the operating room being worked on by plastic surgeons to fix his feet, his arms, so that he would regain function back. So that's what we do as plastic surgeons. So let's see, let's skip all this.
Wow, that's interesting.
So this is what plastic surgeons do. We put people's body parts back together. So this was an agricultural machine accident and or a assembly line worker type of accident. When I was an intern, basically my first year in residency and training, I was on call. And the ER called me down to see a patient. I went down to the ER, and they had put the patient in a separate room by himself. And it was a little dark, so I turned on the lights, I walked in, and all I saw, I actually didn't see a patient, a person. I saw this black thing in front of the patient. And so I walked around, and the patient was behind this black thing. And as it turned out, this person, so I did my training in Illinois, and there's Firestone and Bridgestone factories in Illinois. They make tires, right? So this particular assembly, not this particular person, but this person that I saw in the emergency room, he was one of the assembly workers in the Bridgestone Firestone tire factory. His job, only job, was to push this amorphous rubber into this assembly machine that would suck up the rubber, heat it up, mold it, and at the end spit out something that looked like a tire. That's his job. That's it. He just pushed this amorphous. So he's pushing, 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 and somehow, I guess that night, of course it always happens at night, the machine malfunctioned. And it somehow didn't stop when he got caught in it, and it took one of his hands with it, and of course he screamed. And so his coworkers came to his aid, turned off the machine. They couldn't get his hand out. So they had to take the machine apart, cut the rubber, because his hand was in it, and then bring the rubber with him to the ER. So that's why I said I saw this black amorphous thing that was in front of the patient. I couldn't even see the patient when I first walked into the room. Because I was a first-year resident, meaning that I didn't have that much clinical experience, of course, I called my professor and described what happened. The professor came in and basically had to repair the patient along with a more experienced doctor, plastic surgeon and such. So I didn't get a chance to scrub in to see what actually happened. But I know that he ended up having to have, I think, a couple of fingers amputation, but they were able to actually preserve, I think, a few, maybe one finger or two. But anyway, so these are things that we see as plastic surgeons. So you wouldn't really see this as a dermatologist. And so in medicine, you wouldn't really see something like this. But this is what surgeons see. And so of course, this is someone who amputated his hand, but you can see the wires, right? So we're trying to replant his hand back together. That's what this is.
I have to interrupt Dr. Lee for a second. You have a patient that is concerned that this was getting worse. So she sent this, she had called. Saying that she wanted to make sure he was
There's no way.
No?
I wasn't expecting my hand.
Sorry about
That's
that.
the first image.
Jaden's like,
The nature of being a doctor, we have patients that are concerned.
That's how many years old.
Patients come first no matter what. Okay, she's back.
So for something like that, you actually do need the microscope to repair. Because not only do you need to, so we think about putting the hand back together. We don't just sew the skin to skin, right? Because you have blood vessels, you have tendons. Because how do you think your fingers work, right? You must have tendons that are intact for you to do this, for you to flex, for you to extend, and you must have sensation at the tips of your fingers so you know what you're grabbing, how to write, and all that. You have that sensory feedback so that your hands are useful. Otherwise, your hands are not useful. So not only so you actually have to repair the tendons, you have to line up the blood vessels, you have to line up the nerves, do the nerve repair and the blood vessel repair under the microscope, do the tendon repair, and then lastly, the skin repair. So the skin is the easiest actually. Everything else is actually harder. So that's where the microscope comes in. The microscope, typically the sutures or the stitches that we use under the microscope is something that's finer than your hair. The needle can actually penetrate through one of your hairs, one strand of your hair. I think I have a picture of that. This is it. So this actually is the needle. This is someone's hair. And the suture is right here. So that's why you need a microscope. Otherwise, you can't see it, right? With your naked eye.
Which one's which?
Okay. So this is the hair. This is the needle. This is the
Needle went through the hair.
the needle penetrated the hair, and the suture is here.
The suture is smaller than the hair.
Yes.
Yeah.
so how long would it take to repair like the hand that you had up there?
Probably anywhere between 8 to 12 hours.
Wow.
Right.
When you were actually when you scrubbed into your first surgery and you were hands-on with the patient, were you nervous? You were nervous if someone's going apart or anything?
When I was in training or after the training?
Well, when you're in training, like
You're always supervised, right? So you're never in there alone. So the professor is always there with you, at least for my training program. I always had a professor that was there with me. So even though, yes, I may be doing the surgery, but the professor is always looking over me and next to me, assisting me, so he or she can see exactly what I'm doing. Now, of course, regardless of whether you're in training or out of training, it is your responsibility to make sure you know that surgery like the back of your hand. It is your responsibility to be able to memorize the steps to that surgery. It is your responsibility to know the anatomy like no one's business. Indeed, for those reasons that you mentioned. It's someone's life, it's someone's hand, it's someone's, right? And so this is why I said studying is an endurance sport. It's not just memorizing this. You must be able to apply what you've memorized. And in order to memorize all that stuff, that's where the endurance sport comes in. And the endurance sport of doing 12, 16-hour surgeries. So actually a lot of my co-residents, meaning the same people in a training program, they were all triathletes. And they actually placed in the Ironman race in Hawaii in their age group. So they were actually amazing individuals. They were not only great surgeons, but they were also great athletes. But that endurance of being able to do that Ironman allowed them to be able to do surgeries like marathons.
A lot of people in our field are, at least a lot of our colleagues are amazing individuals. They
Yeah.
almost seem superhuman in some ways. I mean, they're masters of time management to start with. It's like they find ways to study in the shower. They find ways to train for Ironman triathlons while being residents.
Right.
You know, when you're supposed to work 140 hours a week and they still find time to train and still qualify for Ironman in Hawaii. That's no small feat. These guys are like, they're running outside at probably 3 o'clock in the
3 o'clock
morning.
in the morning, yeah.
They would tell us, they would come to work with like blood on their head because the one story I heard was he got attacked by an owl while he was running around that time. Because an owl thought he was some kind of animal or something that the owl could pick up. But he picked the wrong animal to fight with. So I think he beat the owl up and he just had a little bloody face.
Yeah, but indeed, absolutely. I think every responsible, ethical surgeon should always know before before going to surgery, what you're supposed to be doing. Same thing, in my opinion, for nurses who are taking care of patients. You should know your patient, all your patients, however many patients you have, you should know them. You should know their medications, you should know their allergies, you should actually get to know their likes and dislikes. Because in my opinion, as a nurse, when you're doing bedside care, so much of that therapy comes from your compassion to the patient, right? Knowing the medications, allergies, all that, that's just the basics. That's the most baseline stuff. But what you need to provide for that patient is compassion, because that's what the patient needs. When that patient is ill, uncomfortable, in pain, lying in bed, they want someone to listen to them. They want someone to understand where they're coming from, why they're complaining about pain. And so that's why it's not just about knowing, having the knowledge base. It's actually also that compassion, that kind heart, and the empathy, the ability to understand where someone's coming from, and to put yourself in their shoes.
She's saying, don't do it for the money. It's hard to be so motivated for your patients. Especially if you're a surgeon, you're so invested in your patients that there's so much. I mean, if you were just driven by money, you would just quit. You wouldn't be able to go the long haul. You need to be motivated by you care about other human beings. And because of that, that'll drive you to do lots of superhuman feats, like stay up late for your patients, take phone calls in the middle of a presentation to make sure your patient's okay. That's what I was doing. And yeah, it's because we really do care about our patients a lot, and that drives us. And there are so many of our colleagues that do it because they like the fame and the status and the money that goes along with being a surgeon. But those are the ones that burn out kind of easily, and they don't make it as well. So make sure you're in it for the right reasons, and then all of a sudden 150 hours a week is no problem. Next question.
Have either of you guys lost like a patient in surgery?
Well, it's pretty common if you're trauma surgeon.
Yeah.
I think
Sometimes-
when I was doing trauma surgery, I would lose at least a patient a week. Makes you feel like a bad doctor. Yeah, that happens. Some of them are cops because they get shot. You know, they're good people and you don't want to lose them. And that happens. You get used to it a little bit more. But I mean, if you really care about your patients, it is always hard because you're a human being too. But it's like your question before about what is it like your first time in the operating room. It is very exciting, it's very fearful, but you start to see it as another day at work. And it becomes a very peaceful place. The operating room, even if things are a little hectic, it is a place where people can't text message you very easily if you're in the operating room because your phone's outside. So yes, your question.
So when you guys were in medical school, I know that you guys were very busy, and I know that, you know, people often say that you don't have a life. Is that true?
Yeah, that's pretty true.
110%. Absolutely.
No, your life needs to be your books first.
Yes.
And if you don't do it that way, you're likely to fail.
So I see life in this way. I've always felt that I think that all of us have a certain amount of work to do in our entire lifespan. And you can choose to do a lot of your work when you're young, when you're energetic, when you're, capable, or you can decide to divide this work up evenly all the way until the very end, until you're ready to die. So I would say that someone who wants to become a doctor or a surgeon, they're doing a lot of the work in the beginning. And so indeed, for surgeons like us, and I will share this with you, but I mean, it never really bothered me, but as a woman in surgery, it's extremely, extremely rare when I was going through it. And the plastic surgery residency that I went to, I believe I was in this entire history of plastic surgery residency, I was the 5th or 6th female. That's it. And the very first Asian. All the women before me were blonde and beautiful until I came. And so, and the reason I know is because we actually have this library at the residency program, and they have pictures of all the graduates from the
Our
previous
pictures
years.
are there now. I heard people
Right.
throw things at it.
And it's men. Oh, a woman. Men. Oh, another woman. And it's a very male-dominated field. There's nothing wrong with that, of course, because historically, men are the ones that go out to earn a living. So it's a relatively recent phenomenon that women are actually working outside of home, right? And so at my residency, what I wanted to say was that there was an unspoken rule, but everyone knew it. It was not spoken, but everyone knew it. As a woman in the surgical residency, you do not get pregnant at any time during the 6 years that you're there. 0.
So that's like,
No
your
one.
life is different.
Right.
I mean, to answer that question, do you have a life? I mean, you choose your priorities differently. Of course you have a life, but your life is studying. Your life is taking care of the patients.
Right.
Your life isn't like how your friends will have it. That's a tough thing because you'll have other friends outside and they're making money and they're going to parties and they're doing all these great things. But your life is different. Your great things are you're saving lives, you're studying for your future, you're planning in a different way, you're pushing away some of those other parties. But guess what? Someday your parties are going to be bigger than their party. Your house might be bigger, but you just have that hope that maybe someday you'll get there too, and that gets you going, that you decide that your life is a good life, and your life is, being in a class with a bunch of other doctors and studying, and that's the life you chose, and that works. And then you find ways to prioritize, and if you want to train for Ironman, you find ways to do that, but you don't get to train in the middle of the day for Ironman. You got to pick 3 a.m. for that.
When you're not on call.
When you're not on call, because you can't just stick to the hospital. That's one way to get fired if you left the hospital.
Yeah. But having said that, like I said, I know that I actually finished my residency training, I think, even before most of you were born. And so I don't think that that's the case anymore. I think that they're a lot more lenient, a lot more open to to having women
Yeah.
in training programs, including surgery.
But keep in mind, we were mainly talking about surgery. Surgeons are more like hardcore doctors. When you're listening to a bunch of surgeons talk about it, maybe talk to some medical doctors and see what they think of surgeons. They might just think we're a little crazy. But we're the ones that just do everything to the extreme. Our training is longer, our suffering is harder, and we think it's worth it.
Right, so just to, I don't know whether you guys would understand this, but this is actually somewhat funny. So when I was a plastic surgery resident, when I was in training, some of my colleagues, co-residents, were walking down the hall. And there were a couple of dermatology residents, right, the medicine equivalent of plastic surgery.
So you've heard of Dr. Pimple Popper? That's a dermatology resident. I think it was actually Dr. Pimple Popper that was walking down the hall. She was in our class. Well, we don't hang out with the dermatologists because those guys are like not the popular kids. We're the surgeons, we're the popular kids, so we ignore them. But Dr. Pimple Popper now is kind of more popular than we are, so see where they are now. So she was like the nobody back then. So Dr. Pimple Popper was walking by, and go ahead with the story.
So plastic surgery, so it was actually 8 o'clock in the morning. And my co-resident and I were walking down the hall. By that time, we had already rounded on our patients, we had seen our patients, we had actually done the daily care for the patient, all the patients in the hospital. We had actually gone and met with the attending, the professor, gone over the plans and such, and then we were actually, because that day we actually had clinic, and so we had a little bit of time to walk down the hall. If we were in surgery, we would have started at 7:30. So anyway, so we were walking down the hall, and the dermatology residents were walking the other way, and we weren't talking, we didn't know each other, but we overheard the dermatology residents saying this: "Oh my gosh, today is one of those terrible days. Gosh, we have to be here at 8 o'clock. Oh, and then we can't leave until like 5."
Oh my gosh.
And so typically most plastic surgery residents are there. So my normal day would start at 5 a.m., meaning I'm there at the hospital ready to go at 5. I usually didn't finish until whenever the work was done, which could have been 8, 9 o'clock at night. And so that's a fairly typical day for me. And so do I get a chance to eat? I ate Payday a lot, the candy bar. And that sometimes was the only thing I ate for the day. And so, yeah, so there was not a lot of time, but you know, like Dr. Lee said, that's the lifestyle I had chosen because this was something that I knew I wanted to do. And so whatever got thrown at me as part of the process, it was good, it was fine. And I welcomed them as challenges. And I looked at them as challenges to overcome, and I'm happy to overcome them. That's kind of how I looked at them. So yeah, so that's kind of funny, but
That's a little bit difference between the hardcore surgeon mentality versus the little more reasonable lifestyle mentality of a medicine doctor, like a dermatologist versus a plastic surgeon. So we're the ones getting up at 4 in the morning. They're the ones complaining about getting up at 7 in the morning. It's a little different.
so I don't know if we have that much time. I don't know what you
When-
guys'
when's the hard
schedule.
stop?
Yeah, is there a hard
So the
stop?
bell rings at 2:16,
Oh,
and
okay.
it's 2:02 now.
So do you guys want to ask questions, or do you want me to keep going with the slides?
So keep going.
Okay, so I just wanted to briefly talk about plastic surgery. So how did plastic surgery, the plastic and plastic surgery come about? So definitely not plastic bottles or plastics. It's actually, right, it comes from a Greek word, plastikos, meaning to mold or to give form. So that's where plastic comes from in plastic surgery. This is a diagram of a very old, ancient plastic surgery. It's one of the first plastic surgeries described, where you guys probably learned in your history books that in some of the countries in the past, they would punish criminals by cutting off their noses. Did you guys learn that? Anyway, in India and in the Middle East, and such, that's actually what they did because it's so obvious on your face. And so they want to make sure that people knew that you had committed some sort of crime in the past. And so that's why this type of reconstruction, they were using a tissue from the arm to actually recreate a nose. And this is a contraption to keep the arm here, because otherwise, can you imagine trying to hold your arm here? You would just, right, drop it. So that's the very first written described plastic surgery. So what cosmetic surgery is, which is all over TV, it seems like these days, basically is to reshape something that's normal to improve it. So that's what cosmetic surgery is. So it's not necessary, it's totally elective, and so on. But reconstruction, which is also part of what we do as plastic surgeons, we actually take abnormal structures, whether they're born with it, due to trauma, infection, tumor, or any other disease processes, and we try to either take it out or improve its function and appearance. And so that's what we do. So I probably go through these slides fairly quickly. These are just pictures. So this is an example of cosmetic surgery. So you guys, what did this person have done? Can you
The
tell what
nose
the
and the double
Yes, the nose, yes, exactly, and the double chin. So she had a nose job, she had liposuction. This is, can you tell the difference? She had a facelift. Good job. Oh my God. So which one's before, which one's after? Yeah, the before is this one, the after is the other one. So plastic surgeons do amazing things. We can recreate noses for people without connecting your arm to your head anymore. We can do it some other way that's much easier and gives you a much better outcome. So this was due to tumor. This was a cancer removal, and so reconstruction after. So this is someone, can you tell what was done for him?
The eye bag?
Yes, exactly. So the eye bags, they're so bad that we just went ahead and removed them. So this actually is considered cosmetic. Although he was complaining that when he looked down, the bags were actually in his way. So insurance actually did pay for this particular surgery. Can you tell what was done here?
Lip?
Yes, the eyelids. The eyelids and the brows, right? Because she was complaining that she couldn't see, right? So then she had a brow lift and then she had an eyelid surgery. So she could see better after. What's this? What's this?
The burn?
Actually, it's not a burn. It's a birthmark. Yes. And so we use laser to treat the birthmark, to lighten it. So that's just before and after. Okay, so this is a little bit harder to see because it's a bit washed out. So if the lights were a little dimmer, I think you'd be able to see. But for the sake of time, right, I just want to show you what was done to actually basically reconstruct. So what happened was he had this bad burn scar here. And so because he's relatively young, you can see, and if you look at everyone's forehead, there's not much excess skin, right? So for a big scar like this, there's no way you can just close it. So that's why we put tissue expanders here and here, balloons that blow up the skin so that when the skin gets stretched out, we can then remove that scar and close the skin together. So that's the end result. This relatively young lady with skin cancer of the nose, we reconstructed that for her. This is melanoma. You guys know melanoma, right? Yeah. So it's an elderly person. And so we took that out, and that was a defect. That's her on the table. So it's almost like her entire cheek, right? That's her after. So we took a big, we call flap, skin and tissue from the neck all the way up this way. We swung it over. So that's that. What's this? What's it called?
Cleft palate?
Cleft lip.
Oh, cleft lip.
Yes, cleft lip. So this is a baby with cleft lip, repaired, and a little older. The first slide was one-sided, unilateral. This is bilateral, meaning both sides. What's this? Which cartoon character has this?
The regular show?
What's that?
Missing a thumb.
Yeah, it's missing a thumb. So this is a baby born without a thumb, actually. So this is actually not uncommon. So what we did, so that's the baby after holding his little truck. So what we did was we actually made the index finger into a thumb for him.
So what cartoon?
Right, what cartoon character has 4 fingers?
SpongeBob?
Huh?
SpongeBob?
I don't know if SpongeBob, maybe, you could be
Oh,
right.
yeah.
I was thinking The Simpsons, actually. Yeah, The Simpsons. So, this was a car accident. This was a young man, I think he was only 15 or 16. Car accident, this is what happened. So I saw him in the ER just like this. So I took him to the operating room and cleaned everything out, repaired it for him. That was the repair right after, and that was him about a week after. So everything had healed up pretty well, and you can see that he's put back together fairly well, but he's gonna have quite a bit of scarring, right? But most of the scars actually went away for him. This is a more extensive version of what you saw there.
Is that his hair?
That's here.
Yes, someone got de-scalped.
The hair
That's right, the eyebrows are here. That's her after. Yep, those are her eyebrows here. Yes, so, yes, indeed. What's this?
A lip
Yes, what happened to the lips?
Sort of slides.
Huh?
cut.
What
It
kind
looks like
of
it got big or something.
Yeah.
Like by
Like
a dog.
animal.
dog bite? Exactly.
That's
This
a
is
dog bite.
This is
Yeah.
dog bite. Yep. So, that's what I did for him in the ER. I actually did the repair in the emergency room for him. That was him 6 weeks later. So, yeah, so this is what we do as plastic surgeons before and
Wait,
after.
why do you
Wait,
wait?
hold on.
Why is his eyes like that?
Why do you like purposely blur the eyes, or is that like his?
Yes.
Oh, okay.
Yes,
It's like,
yes,
It's for the
yes.
company.
So you can't see who that
No, I
is.
don't know.
So what's this? Yes, good job. Those are
Is that a
burn.
baby?
No.
So, as plastic surgeons, we resuscitate burn, and this is something that's shared with trauma surgeons, that trauma surgeons and plastic surgeons will work together to resuscitate burn victims and such.
Who's
And-
the guy in the middle?
Yes, so he recovered and got to spend time with his wife and kids, and he looked fairly normal after. But, yeah. This you probably wouldn't know what it is, but it's usually happens in someone who's a little bit older. So he actually can't straighten his ring finger. So we actually took this out of his finger. It's very fibrous and very firm, very hard. And so now he's able to straighten his finger. Yes?
Can he still move it?
Yes, absolutely. Yep. So it's restoration of function.
The hand surgeon's a subspecialty of plastic surgery.
Mm-hmm. Yep. So that's what we did before and after. What's this?
Breast lift.
Yes, they're breast cancer. So this is someone who had mastectomy. She's a little bit overweight, but this was actually after mastectomy. So we did breast reconstruction, we did the nipple areola reconstruction, so this is actually cancer reconstruction. What's this?
Skin tags?
Not skin tag, but it is on the skin. Have you heard of keloids? Okay, keloid is abnormal scarring. So scars shouldn't look like that, right? So we want to try to make it better, so we did some steroid injections and it does look better. It's not completely gone yet, but it's definitely a lot better. What's this?
Oh, there's no like holes, it's like areola.
Okay, so what's this condition called? And I'll give you a clue, it's in a guy.
Male patient.
It's a male patient. It's called gynecomastia. Have you heard of that? So gynecomastia basically means that, and there are some men who have, who develop breasts for one reason or another, and a lot of times it's due to, if it's an adult, it's usually due to steroid usage. And so people sometimes take steroid supplements and or steroid-like substances to build muscles and such, but this is also what happens. So we did liposuction, and that's the end result. So, before and after. So, a little bit more normal on the other side. So, what's this?
Tummy tuck.
Yes. So this is someone who had gastric bypass surgery. She lost 150 pounds. So she had all this extra skin. And so we removed all the extra skin for her and then tightened, yes.
Did you remove her belly button?
I preserved the belly button. That's actually her belly button. I just brought it out for her. I left it where it was. Yeah. So pretty much that's it. So any questions? Yes.
Do you guys have any children?
No.
We don't have any children, no. Yeah, we don't have any kids.
Do you guys want children?
Our staff, our office staff are our kids.
So do you guys think that surgeons are able to have a family or?
Oh, absolutely, absolutely, yeah. No, it's, I think that I know a lot of surgeons who have families. I know a lot of surgeons who actually have kids, sometimes actually before the training.
Oh, wow.
Yeah, so like, they may take a few years off between college and medical school, and then they have a family, and then they do medical school and training.
Natasia has a question.
Yes.
Yes.
For cosmetic surgery, like nose jobs, do you guys get a common celebrity that most people ask for?
I'm sorry, what was the,
For nose jobs?
oh, for nose jobs, yes.
Do people ask for a celebrity?
It used to be that way, that people would say, oh, I want someone's nose, I want this person's nose, but not so much anymore. I think that people are sort of, these days realize that it's, the nose that looks good on someone else may not always look good on another face, if that makes sense. And so in some ways, someone who looks pleasing to the eye, typically is someone who's well proportioned, right? So you can have someone who, oh, there it goes.
Oh, it's okay. Yeah, go ahead.
Oh, okay. So you can have someone who may have very little eyes or very fine structures and such, but then if they're harmonized, they look good. You can have someone who's maybe a little bit on the heavier side, but then they're well proportioned, so they look good. And so I think that for someone to look good, or I think the most important thing is for whatever surgery they want to complement what they already have and to enhance, in my opinion, what they already have. Not to take away, not to distract. So, yeah. No question. Yes, I think Natalia had a question. Did you have a question?
Oh, no, you already answered.
Oh, okay.
Well, thank you very much. It was really informative, really good.